The Eastern Cape Department of Health, led by MEC Ntandokazi Capa, is running a cataract surgery blitz at the Frontier Regional Hospital. And starting October the 3rd, which was yesterday, 100 patients will then receive surgery over 3 days as part of World Sight Day under the theme #LoveYourEyes. Now, this effort aims to prevent blindness and also improve the quality of life within the province. And to further engage us on this, we are very pleased to be joined by the MEC. MEC Capa, it's a great pleasure to have you with us on the show. Now, you bring very progressive news this afternoon. Tell us all about this wonderful initiative.
Thank you very much. Greetings to you and the viewers. It is indeed a very exciting blitz, an exciting program that we are doing in partnership with the Al-Imdad Foundation. We are trying to make sure that we improve the quality of life for our communities. We understand that as the province and as a country, we do have backlog, especially when it comes to cataract. And cataract affects mostly the elderly. So we decided that let's try during this month and make sure that we reduce the backlog that we have as the province. So we decided on this blitz.
So you are catering for about 300 patients in the next 3 days, starting yesterday. This type of surgery, MEC, is quite a quick one. It's a quick procedure. Talk to us about the intended beneficiaries. Who are they and where do they mostly come from? You've mentioned the elderly already.
Yes, mostly it's the elderly, and they come from our rural parts of the province. Because we are hosting our blitz in Frontier Hospital, we've got a state-of-the-art facility there called Sabona Eye Care Center, and we've got about 2 specialists that will be operating. They started yesterday. They started a day before yesterday. I was there just to see the few that were getting a surgery, but they will continue until tomorrow. But what we know, they are from the rural parts of the province. We managed to take them from All Saints, Enoch, all the surrounding municipalities that are close to Frontier, so that they don't have to travel long distances. So it's mostly the elderly for now, and it's targeting the rural areas close to Chris Hani district, which is the one that is hosting us. But it's also local municipalities around the Chris Hani district.
Let's further expand on that point, MEC, because in terms of other health matters that have been identified as a concern within the province, like, for example, the cerebral palsy children in some of the villages in the Eastern Cape, where the parents don't even have access to quality health care or simply do not have the information that is needed with ways to improve their child's conditions. How is your department also looking into bringing similar assistance, especially in those poor villages that are often far from healthcare facilities?
We have about 11 centers across the province that deal with the cerebral palsy. I think a month ago, and 2 months back, I was in Doranginza and in Sisila Makiwane trying to improve those centers. We call them centers of excellency. We've handed 2 contractors, one in Doranginza and one in Sisila Makiwane, so that we improve those facilities so that they are able to give what our communities need. And again, it's not only providing a healthcare, but we are also training those who are in the rural areas, like the ones in OR Tambo. They will be trained in Sisila Makiwane. Others from Sarah Batman will be trained in Doranginza, so that we make sure that once they are trained, they go back to our communities and give that service to our communities.
Now, MEC, you obviously had to do lots of screening in order to identify those beneficiaries. How was this process actually conducted, and will you be considering the extension of this initiative beyond these 3 days, if of course there's a need?
Definitely there will be a need, because it's not much that we are doing, because we've got a lot on the backlog. We're sitting at about 10,000 people. So we said as a department, we'll do a blitz in the northern part of the province, and then we'll move to the western part of the province, which is the Gqeberha area. We'll also do one in Umtata. We'll also do one in Buffalo City. So we want to make sure that we touch every part of the province. Even next month, we'll do another one, but it will not be a cataract, this one, but it will be an orthopedics blitz. Again, that's where we have a backlog as well. So we are trying our level best as a department, so that by the time people don't have to wait for long time to get our services, we must try and do this marathon or blitz so that we reduce the number and also reduce the waiting period.
And MEC, maybe a quick one just in closing. How are those beneficiaries, maybe Ogoko, that are still sitting in the villages, how do they get on the list? Do they have to go through a specific process, or they can just come through to the hospital and surgery will be, of course, performed on them?
We invite them to come to our facilities, those who are able to. At the same time, we always do our outreach programs where we do screening as the department. Once we screen you, then we are able to put it on the list. At the same time, we've got what is called Wabakot teams that visit communities. When they identify one, they are able to put them on the system so that they can get the service they need.
All right, great news there, MEC. Thank you so much for your time. That is Ntandokazi Capa, the Eastern Cape Health MEC, there on the launch of the cataract surgery blitz campaign.